Welcome everyone who's here. I am Rabbi Idit Solomon. I am the founder and CEO of Hasidah, and Hasidah, along with Temple Emmanuel and The Kitchen, are sponsoring this program this evening. This program came about through many discussions in the community and an interest from people to discuss what happens when you think you want to have a family one day, but it doesn't seem to be going on. I've heard and experienced many stories of the insensitive comments that people make about this. We actually made a video recently called Stupid Shit People Say About Infertility. It's really what it's called. I think that we could actually just make a video called Stupid Shit People Say About Family Building. I don't think everyone really recognizes the pressures, the many issues we have. They're work related, they're spiritual related, they're medical related, they're social, emotional, they're about relationships. The identity of mother and parent is really ingrained in our identities from an early age. So this panel was a response within the Jewish community to talk about several different aspects involved with that. Just some administration. We are going to have our evening with our panelists, and it's going to be facilitated by Rabbi Sydney Mintz of Temple Emmanuel. So I'm going to turn that over to her with a deep gratitude for all of you who are here and to our hosts in advance. Thank you all for coming. And I now turn it over to Rabbi Sydney Mintz.
Thank you so much, Idit, for helping to host this and organize it with Temple Emmanuel and with The Kitchen. And it's wonderful to be here with all of you and to talk about something that may have been on the back burner and has come forward for you in your life at this time. It seems that there has been a huge pause button pushed for so many people's lives, but we have to unpause that pause button in so many areas of our lives. And I have a 24-year-old son, a 20-year-old son, and a 10-year-old stepson. And as a queer woman, had to avail myself of alternative fertility technology. So I feel like it is a great blessing and a great gift. It's something that we owe ourselves to bring out into the open and to really talk about and give support to alternative families in every way possible. And we are joined today by three people who are experienced and experts in the field. Samantha Franklin is a licensed clinical social worker, and she is going to speak first. And then we have Dr. Peter Klatzky with a couple of beautiful kids I can see right there, who's a reproductive endocrinologist at Spring Fertility and has a great passion around this. And finally, one of my colleagues, Rabbi Jill Cozen Harel, who herself is a single parent by choice and does pastoral care in the community. So we're going to ask Samantha and Dr. Klatzky and Rabbi Cozen Harel to each speak for a few minutes about the place that they are coming from, not giving us really any advice, but sharing wisdom. Then I have some questions that we're going to be asking, and then we'll open it up to all of you for some Q&A, because I know that this is a sensitive subject. It's something that is very profound in every way in our lives in terms of present and future fertility, present and future family building. So I feel really a great indebtedness to the three of you who are going to share your expertise with us tonight. So Samantha, I'm going to let you take it away.
Hi, I'm Samantha Franklin. I'm a licensed clinical social worker. It's nice to be here. Please bear with me. So a little bit about my story. I dated quite frantically throughout my 30s, really trying to get married, and did finally end up getting married at 36. And then, met my husband at 36, got married at 39, started trying right then, and then followed that with 2 miscarriages and beginning my IVF journey, which took me several years to complete, and did complete. And I have twin girls that are now 6. So it was a happy ending for my story. Definitely had to go through a lot to get there. All of it was worth it, but it was definitely a journey. So for my single clients who want to have children, the questions that I get a lot is, should I freeze my eggs now, or should I wait? Should I pursue being a single mother by choice, or should I focus on dating? Should I use donor sperm, or should I adopt? Concerns about what if I find out something's wrong with my fertility? How do I choose a sperm donor? Should I choose a known donor? How would I tell a kid about this? Is it okay to do this? And finally, how can I choose to not have kids if that's not what I want to do? So I think that we can start some of these conversations tonight. I think these are really in-depth topics, and it's really great to have a support group that you speak with about these issues, to have a therapist, or to really, most importantly, have other people that have gone through what you're going through to talk to as role models and gain from their experiences. The only general advice I'll give here is just to go where it's warm and surround yourself with people that are going to support your path. Last thing I just want to say is that this is an area where, you know, women have been historically incredibly disempowered and now have a lot of options and independence, and it's really exciting. Sometimes it's a little much because there's almost too many options, but I really encourage people to do your research, arm yourself with all the information, and take the time to really thoughtfully explore your options. And finally, there are 45% of all people in the US are unmarried, and single mothers by choice is the fastest growing population of pregnancies in over 35 population. So this is very exciting as well. So if that's a path that you choose. Okay.
Great, thank you so much, Samantha, for that, and we'll get back to you. And Doctor, give us a little bit of your perspective and your thoughts on this.
Hi, everybody. It's nice to be here. So I think that Samantha hit a lot of the key issues, and from my perspective as a provider, it's just an amazing time where I'm blessed to be in a field that has developed so rapidly and has been able, and I'm able to offer so many services to people that were not available even 10 years ago. The way I practice fertility today is quite different. So our team at Spring Fertility, and I'm sure this is true at most fertility centers around the country, see many women as individuals and also couples, same-sex, heterosexual, and otherwise, who just want to start a family. And we view that as our mission is that we want to help people achieve whatever their goal is, and we have a vision that anybody who wants to have a child should be able to have one. And historically, women will often choose between, pursuits early on in their life, whether they're professional pursuits or personal accomplishments and pursuing passions, and having a family. And probably the biggest social advance and advance in our field has been egg freezing. It has allowed people to have some peace of mind, both while pursuing things professionally, but also personally, dating. I'm sure we all know friends, loved ones who felt pressure dating in their early 30s. That every date has to be for this one person, and a need to decide and to determine whether this relationship is right or whether they need to have a child now versus pursue some other goals. And so the concept of egg freezing or oocyte vitrification is to give people more options. Many of my patients that I see today, interestingly, for egg freezing, are not necessarily sure they want to have children, but they want to have options. And so, when Samantha was saying she works with couples who are debating having children as single mothers by choice, I sometimes see single women who want to have a child. That's certainly the fastest growing demographic of women seeking donor sperm. But oftentimes people will freeze eggs. And I have many patients who are 39 or 37 who decide, at 40, I want to start having a family with or without a partner as a single mom. But I'm going to freeze eggs first. And some of my patients who've frozen eggs, maybe at 36, and then they're back and we're having a conversation at 40, will often leave those eggs frozen and use donor sperm with artificial insemination, which is an easier process. And one of the purposes of leaving those eggs frozen is you might find your life partner when you're taking your first child to nursery school, and we have the technology and the ability to have children later on, particularly if you have eggs frozen. I'm happy to share some data on what happens, but the concept of egg freezing is to basically preserve your eggs at the age where you are. And then any embryo that's created in the future, it could be even 10 years later, the chance that that embryo is chromosomally normal is tied to the age when you froze your eggs. So that's egg freezing. Caring for same-sex couples is one of the more fun things that we do. A woman who's been trying to conceive for 12 months, 6 months, without success is usually really hurting and has been through a lot of suffering before she even made it into our office. A same-sex couple, it's an exciting endeavor that you're just at the beginning of, and often come with really a lot of excitement, joy, and eagerness. And for a young woman who's looking to freeze her eggs, she comes in often looking for, with trying to fit something in a busy schedule so that she has more peace of mind. And one doesn't freeze their eggs just because they're absolutely committed to having a child. The idea is to provide options and to minimize the risk of discomfort, disappointment, and pain later on. So I think those are the big differences. One other thing that has also occurred in our field is the ability to test embryos for genetic diseases. Since this is a Jewish community that we're speaking to, I really feel strongly, I've been tested, my wife's been tested, we don't do a good enough job of making people aware of the high rates of BRCA1 and 2 in our community. Jews, about 1 in 40 to 1 in 47 Jews carry a gene for breast cancer or breast BRCA1 and 2, which lead to very high lifetime risks of breast and ovarian cancer. And in addition to fertility-related issues, there is, a recommendation that you may consider a bilateral mastectomy and even removing your ovaries when you're done childbearing, or by age 40, to minimize the risk of getting cancer. And it's something that we can, if someone's trying to conceive, we can help her have embryos and future babies without carrying and passing on that condition. If you are positive, then there's a very different type of screening that should be going on for both breast and ovarian cancer. So that's another new opportunity in our field. So I think that we continue to help more and more women have children alone, and that's not too complicated from a medical perspective. Same thing with same-sex couples, using donor sperm, donor eggs, if that may be the case, and occasionally gestational carriers. And then the really proactive advance in our field is the ability to help women when they're younger, take actions to minimize the need to go through multiple miscarriages, multiple IVF cycles, failures, and disappointment and pain in the future. And it's not a perfect technology, and I think educating patients what the realistic expectations are and the realistic probabilities is a really important thing, particularly with egg freezing, because the outcome is so far away. So you want to make sure people are really well informed of the potential benefit, the uncertainty, and the potential outcomes. I'm happy I have some data slides if people are interested about aging and reproduction, but I'll hold on that unless we have questions.
Great. Thank you so much, Doctor, for that perspective. We will definitely be coming back to you because I think there's some, a lot of the questions that have come up in conversations have to do with the technical aspects, the medical aspects of this, in addition to the, the psychological and the social aspects of it. And also, as you pointed out, there's a lot of pressure in this area in general about building families. And, the first commandment in the Tanakh is Peru or Revu, to go forth and multiply. And so, there's this balance that we also have to hold between this pressure that Jewish individuals and families feel to procreate, but also giving space in every conversation for people who are making these decisions and knowing that your rabbis and your community are going to support you if you choose to have children or not. So I think that that's also something we have to keep bringing up, is that there's also the other pressure from people who feel ashamed about not wanting children or not having that certainty that's impressed upon us from a very young age. and of course from our parents who want to become grandparents, some of them more incessantly than others. So I'm going to turn now to my colleague, Jill Cozen Harel, and Jill is a single mom by choice, and give us a little bit about story about your journey and the way you made the decision, Jill.
Sure. Sorry, I will also say as a caveat, I have my 12-week-old baby here in front of me, so bear with some occasional noise for all of you there. So I guess I'll riff for a second off of what Rabbi Mintz said in terms of the commandment to be fruitful and multiply, puru, because it wasn't necessarily in my mind per se, but it was something that a professor of mine in rabbinical school talked about in terms of whether or not he was willing to ordain or not ordain, distracted by babies or a baby. I'll come back to that in a second, but I think I had the religious obligation piece in my head somewhere, but more than anything else, I think I knew that I wanted to be a parent at some point in my life. And along the lines of what the other panelists have talked about, I spent time trying to find that person in the last number of years, but also was stressing myself out about that. Sometimes I just wanted to come home and do nothing and watch TV and not try and figure that out, and just be with the friends I had. And there was a point where I think I had a birthday where I said to myself, okay, am I now getting to whatever that clock is? Is that clock starting to tick? And is that new pressure on me? And I thought about freezing eggs, and I felt a lot of mixed feelings about egg freezing. I did a ton of research. I read lots of academic articles, which is by my nature. And I felt very conflicted about trying to solve a problem, or not a problem, because I think to what Araminta is saying, being single isn't a problem. Choosing to have children or not isn't a problem. But I knew that children was something that I wanted at some point, and at a point in time, your fertility can theoretically start to decline when you get into your later 30s and 40s. And not having that information was something that I think was starting to stress me out. And so I was conflicted a little bit about solving a non-medical problem with medical procedures. Freezing eggs is something that's invasive. I ultimately froze eggs. And like Dr. Klatzky referred to, those were not the eggs that yielded the baby in front of me. But the doctor who I worked with at the time sort of referred to them potentially as like maybe child 2 eggs, or who knows what. I had no idea what was going to happen, but I had a friend, a rabbinical school friend at the time actually, who was pregnant as a single parent by choice, and said to me, if you're thinking about having a kid, and if that's something you want at some point in your life, you should just get pregnant. She just said to me, just get pregnant now. It's much easier. It's cheaper. Money is something that I think many of us are thinking about in this process too. Just go ahead and have a kid. And that was something that felt way too overwhelming for me. In the same way that people also told me that the data and the numbers are better by freezing embryos versus eggs. But that also, in terms of the ethics of the Jewish ethics, in some ways, I was conflicted about what would happen if I didn't want to use those embryos versus I felt more okay with what I would do with my own eggs. So I froze eggs a couple years ago, and I think we're told, and as I think Samantha and Dr. Klatzky sort of referred to, there's this notion that you freeze eggs and then you feel like you're free. I've heard stories of friends and friends of friends who do it and then feel like they can now go out and have the freedom to date differently or find their person or find their passions. And then like all their pieces in their life fall together lovely. What happened for me is right after my egg freeze cycle, I had a much more renewed desire to actually try and get pregnant and have a kid, like in the immediate future. And I waited a little while because my sister was getting married and I was officiating at that wedding and didn't want to try and have too many complicated things in that window. but that's sort of what, it was the egg freezing that actually catalyzed for me the desire to try and get pregnant and have a kid sooner. And I'll say it's a complicated decision. I think I've had many, many times throughout this process, and I had a miscarriage before this pregnancy, where I wondered if I could do it. And I think the freezing eggs was sort of the stopgap. It was the options. I don't know if I can do becoming a single parent. I don't know if I'm becoming a parent as a single person when I'm choosing to freeze eggs, but I wanted to preserve those options. And I also found along the way a huge community of people in the Bay Area who were asking these same questions and at various points along the process. That was invaluable in deciding and affirming this for me. And I guess the one question I had as I was thinking about this is, if you're thinking about egg freezing, would you regret it if you did do it, and would you regret it if you didn't do it? If I never use the ones that are frozen, will I regret having frozen them? And if I froze them and they don't work and yield anything, how will I feel about that? And how do you feel about it if you didn't freeze them, got to a point, and then didn't need them, or had a really hard time conceiving? Happy to share more Jewishly, rabbinically. Oh, the other thing that I would say about my story, is that what was happening in parallel throughout that process for me is I'd been working on a set of resources for rabbis about miscarriages and fertility loss, right around the same time that I was deciding to freeze eggs and then go forward and actually try and have my own child. And so I think hearing people's stories about loss actually probably catapulted me further in wanting to wanting to have a family. And then when I experienced my own loss, it was no easier, but I had the religious framework, and I had people to reach out to around that. Happy to continue from there.
Great, thank you so much. And we all love the sound of babies on here, I have to say. Babies and children. It's nice to know that they're in the rooms with us. There's been a couple of questions that have come up in all of these arenas, whether it's the social work or the real life being a single parent. But several have come in for you, Dr. Klatzky. I think Edith sent you one of them. I think a couple of people are interested in something that Jill touched on, which is the difference between egg freezing and embryo freezing. And if you could just give us a little bit of like a 101 on that, and not only what's the difference, but is there a better success rate in terms of that, and where has the technology come from? Where is it going in that direction?
Yes, and I spend a lot of hours at work, and I'm home with two little voices who may be jumping in from time to time. So egg and embryo freezing. Embryo freezing has been around since the 1980s. We've been able to freeze it. So an embryo is a fertilized egg. One freezes embryos when we either have selected a sperm source or have the ability to select a sperm source. What you may have heard is that embryos are more effective than eggs. And that's true. And I'll share why that is. The issue with embryos is sometimes people say, well, you should create embryos, is if you have not selected your sperm source. If I'm caring for a couple, if I'm caring for a couple who are a same-sex female couple, then it's reasonable to find the sperm source or the donor sperm source that you want to use in the future. Excuse me for 1 second. I was trying to do this, and I'm gonna create some more privacy.
No worries. No worries.
30 seconds.
Samantha, you want to jump in for that one? Just unmute yourself.
Sorry, I got to remember to unmute. Okay. So yes, I've had clients, I've had single clients who have chosen to do a couple of cycles. One where they'll freeze all their eggs, and then another cycle where they'll freeze their eggs with donor sperm. So basically they have all of their options open. And it's an interest, I mean, these are obviously people who have, say that, yeah, problems with that. Tell me.
Problems with that. So that once you're using the donor sperm, that's a backup plan, and I think as women get older, that's a reasonable approach.
Yeah.
The problem is that egg freezing is an uncertainty.
Yes.
The more eggs we have, the more certainty we have. So, and I apologize for jumping in, Samantha.
No, please jump in.
So look, 10 years ago, all we had was embryo freezing. And so many women would be so frustrated when a gynecologist would say, well, you know, you're 35, you should think about having a kid. And like, you weren't in a relationship. And it didn't seem like a fair question or option. And egg freezing has been around since 2010. It's been considered non-experimental since 2012. And we're increasingly getting better. Freezing eggs is the hardest thing that we do in an IVF center. As I mentioned, we've been freezing embryos since the 1980s, and they freeze quite well. When we freeze an embryo, we expect 99% to survive. When we freeze an egg, we expect 80 to 90% to survive. And and then when that egg survives the freezing, when it's warmed, it now needs to be fertilized and goes through that same process that an egg has to if you're creating an embryo, which is not perfectly efficient. So one egg does not become one embryo. And so if you're going to lose, let's say, 10% of your eggs through the freezing and subsequent warming process, if you did not freeze those eggs, in other words, if you fertilize the egg right away, you're always going to be 10% higher. And that's why the outcomes with egg freezing tend to be better than with embryo freezing are better than with egg freezing. The advantages to egg freezing are, one, optionality. You can choose to use a sperm source later on, and you don't have to define that sperm source today. The advantages, and the other advantage to egg freezing, which is really important, is you have complete control over those eggs. So I always raise that with a couple who maybe, some of you may have a partner, maybe is dating somebody for 2 years, but not married. Once you fertilize an egg, unless you're using donor sperm, you lose control over that embryo. And there's mutual consent required for using that embryo. Embryos have the advantage of eliminating one step of attrition. And I'm going to, if I can share a slide, if it's possible to enable screen sharing, Edith, then I can share what happens to the eggs after they're warmed. But basically, we start with a certain number of eggs that are frozen. And at a center that knows how to freeze eggs, you would expect 80 to 90% to survive. And of those eggs that survive, maybe 75% fertilized. And of those eggs that are fertilized, maybe a third may get to the blastocyst stage, that embryo that you could test. And then if you were testing that embryo to see if it has 46 chromosomes, what you would find is that based on your age, if you're 37, 38, probably half of those embryos are normal. If those eggs were frozen when you were 30, maybe 75% are normal. If you were freezing your eggs or just going through IVF at 42 of the embryos created from your 42-year-old eggs, you would expect 20 to 25% to be normal.
Hey, Peter, let me just jump in here. We're having a little bit of a problem hearing you. You're going in and out. So I'm not sure if it's your microphone or where you are in proximity.
I'll try to speak louder. I'm sorry.
And you're the co-host now. So if you wanted to slip a slide in there, you can.
Excellent. So let me just share and let me know if I need to speak louder. But what I was talking about is with eggs, and anybody who freezes their eggs, this is an important slide for them to see, because it basically articulates that one frozen egg is not an embryo. And when women freeze their eggs when they're younger, there are three advantages. One, you get more eggs. Two, any embryo created from that egg will have its chance of being normal, and by normal I mean have 46 chromosomes and 23 pair, reducing your risk of miscarriage or failure of implantation. And so the woman who froze her eggs at 30, we would expect any embryo created from those 3 out of 4 to be normal. At 38, 2 out of 4. At 42, 1 out of 4. If you are freezing embryos, if you want to minimize risk of loss, embryos start here. So if you had 24 eggs, you're trying to fertilize 24 eggs. But if you freeze them, you have to assume that not every egg will survive that warming process. Important, when you have a normal embryo, age disappears. And the chance of a live birth, of taking home a baby, is about 55 to 65%, independent of your age. And so that's the concept of egg freezing. The important part is to remember that of the eggs frozen, maybe only 1 in 4 make it to the embryo state. And of those that do, the chance that it's normal will be tied to whatever age you were when you froze those eggs. So if you're 39 years old and debating egg freezing versus embryo freezing, and when you meet with a reproductive endocrinologist to have that conversation, one of the questions you should have answered is, how many eggs can I expect to get? And if I'm 40 years old and that number is 4, I might choose to fertilize those eggs given the option. And again, that's a personal decision. The other benefit to embryos, when you're freezing eggs, we look at a funnel like this, and then we try to assume, what is the chance, how many embryos will I have to test? Now, some women may do better than this, and some women may do worse. And we don't know that until we go to worm those eggs. When you're fertilizing an embryo, you know how many made it to here, and you can even test that embryo and find out how many are normal. So you have greater certainty. If and so I've had plenty of couples or plenty of individuals who are 39, only get 3 eggs, but 2 of them make it to the blastocyst, and both of them are normal. And if we were freezing eggs with 3 eggs, you might feel, wow, I really don't have a good chance. And conversely, I've had women get 20 eggs and only 1 make it to a blastocyst. And if she was freezing her eggs, you think, wow, I have 20 eggs. I have really great chance of success, but we don't know. So embryos also have the benefit, in addition to that slightly higher success rate by eliminating a potential loss, because you're further down in what is a funnel towards a baby, you also have greater certainty on the outcome. And the last part of this funnel, so younger women, the reason why it can be helpful when you're to freeze your eggs at a younger age is that you get more eggs, so you have more to start. The chance that the embryo that results from those eggs is normal is higher. But the bigger thing, the third factor that people don't talk about is eggs from younger women make it to the embryo state, make it to a blastocyst at a higher rate. So in green, we're seeing eggs that were fresh. These are about 12,000 eggs at spring fertility that were fertilized without freezing them. And we see that among women under 35, 48% make it to the blastocyst stage embryo, compared to 41 to 42, where that number is down to about 33%. With frozen eggs, it's lower than 48%. Remember, not every egg is going to survive. Maybe it's 40%. And as women get older, the other thing about egg freezing is most of our data is in women under 38. And so, so I'm going to be quiet. I hope I answered the question. I hope that was helpful. But to summarize, eggs, more options with regard to future fertilization. Sperm, embryos, you eliminate 1 step for attrition, so you should expect that each egg probably has a 10 to 20% higher chance of success. And then, and with embryos, greater certainty because you're closer to a baby.
I'll just chime in for a second on the egg embryo thing, not from the medical standpoint at all, but I referenced earlier sort of my perspective on like the ethics of having to destroy them if I didn't use them later on, because some wouldn't make it, but I might have others that you just would have extras of. Beyond that, in that decision point between eggs and embryos, I did also start to look at donor sperm, again, not knowing where my life was going to pan out or how far into the future I'd want them. And at the time, this was, I guess, 3 years ago now, trying to pick donor sperm or just looking at that, other than the 10 minutes I spent on one website, was too much for me. So think about that too, I guess. Like, it's a baby, no pun intended, baby step to sort of think through what you're willing to do and how much of this is options, how much of it is getting yourself ready to think through what this path looks like versus that path. And if you're only willing to do one piece at this point in time, that's something, if that feels right to you.
Thank you, Jill. I wonder if you or Samantha could talk a little bit about kind of the emotional toll that it takes. I mean, there's so many, there's the technology, there's the financial aspect of this that is tied into the emotional toll. And then there's the psychological aspect, which is, just the support that you need around you to do this, whether you're choosing to be a single parent. But can you address that a little bit, maybe with you, Samantha, with people you've worked with? So I'm gonna have you unmute yourself.
I'll get it down at some point. Okay, so what I would say is that egg freezing IVF retrieval is a potentially very emotionally stressful experience. So if you're, and it really doesn't matter when you're doing this, actually, if you're doing it young, there's certain complication risks. And then if you're doing it older, you may have to do it more than once. So the idea is that, now that Yahoo and all these groups are saying, oh, great, you can freeze your eggs and it's covered. I think that's really wonderful. And I think that if it's something that you want to do, that you should do it. And I also think that you should know that you need to be really thoughtful about this process, because sometimes you don't know exactly what you're getting yourself into. You can start and you can find out you have some fertility issues. You can start and it just doesn't go well. Or you can start and it goes too well and you have some complications. So it's not nothing to do this. It's surgery. It's an emotional experience. And it brings up a lot of stuff for people. So not to scare you, but just to caution you that that it is an emotional experience. And it's really good to also consider getting support when you're thinking about all of this, because it's kind of complicated and sometimes it's hard to think it through think everything through on your own.
Great. For the three of you, who do you think are the most important people to be on your team as you're asking these questions?
Can you clarify that? I'm sorry, I didn't really understand that question.
I think if you're saying as an emotional support.
Yeah, is everything support? Who do you reach out to as you're going through this and to answer the questions? I mean, we're here right now. We're going to be doing this for an hour, but as people are going to have more questions going forward, where do people reach out for support, and who are the important people to have on your team as you're going forward in this kind of planning?
I think a lot of people find tremendous support from their friends. So it depends which journey you're on. If you're going down the egg freezing journey, having friends who've done it before is certainly helpful without comparing numbers. And that's really hard because, two fertile women, one may be able to get only 2 or 3 eggs and one may be able to get 20. And it doesn't even mean, and the one who's getting 2 or 3 eggs, by the way, may have a greater chance of getting pregnant naturally. And so that's hard, but friends who've been through this can often support each other really well. Your provider team, you should feel comfortable with, you should be able to answer any questions, and you should know what to expect. You should have an expectation for how many eggs to get and what that will relate to probability wise. Some of my patients, most of my patients who are freezing eggs, their friends are probably their best support. If they're in a relationship, your partner should be, you're probably your best support and be assisting you. And I do think, as the rabbi mentioned, going through egg freezing often, crystallizes the desire to have a child, not just in the woman going through, but often in her partner. And so I have a lot of couples who suddenly decide to make that step later on. And as a single mother by choice, there's some terrific communities online. There's a Facebook community that's incredibly strong. I think all my patients are so grateful for each other, and they have events, they meet, and it truly is, to quote Hillary, it is the community that really comes together and is very strong, particularly in New York, in San Francisco, and major metropolitan areas.
Mm-hmm. Great. Well, we have about 15 minutes left in our session, and I definitely want to let Edith have the final word in terms of Hasidah and the resources that are available. But I know that of the 20 participants, 14 of you have some questions. So I'm going to allow you to unmute yourself, or you can put the questions in the chat, and we will ask them of the appropriate people. And as people are doing that, if either of the three of you, Samantha or Peter or Jill, if there are things that have kind of come up for you right now that you feel are important, that are unanswered questions so far, feel free to jump in. Here we have, we would love to hear Jill discuss more of the considerations that went in deciding to do the single mother by choice route.
Sure. I think some of it for me was knowing from the get-go, I don't know what the get-go was when I was 20 or 30, but at some point earlier in life, that having a family was important for me, and that there was a point in time between egg freezing and deciding to go ahead and try and actually become a single mother by choice, where something shifted in my head. And I, can't tell you exactly when that moment was, but what shifted was that I think I'd felt guilty about being single and felt like I needed to solve that and that was a problem. Perhaps as a rabbi in the Jewish community, pressure both on the being single and on the having children. But there was a moment, my apologies, where that shifted and I no longer felt guilty about it. And I said, I'm actually really happy with my life overall as it is. I'm happy with my Jewish life. I'm happy with my social life. I'm happy with all these things. And what if I can let that go? What if I can let the relationship piece of my life go, hoping maybe that I'll meet that person, that partner one day in my life. But if I don't, I will have, I think, regretted not having a kid. Or I think I'm somebody who had always sort of imagined that I would have fertility problems. For some reason, I can't tell you why that's a thing that I had in my head. I didn't get as many eggs as I was told by my medical team that I would get when I froze them. And I think I just, when I was able to let go, sorry guys, when I was able to let go of that guilt and that pressure about finding that person, it enabled me to think about it. And I think at each step of egg freezing and then again, the sort of, I guess, pregnancy attempt and then future pregnancy, I really took it at each piece step by step. Both with egg freezing and then again with I did an IUI, or a couple IUIs. I said to myself, I'm just going to go in for the consult. I'm just going to go in for the consult. A, I can afford that piece. But B, I just want to see how that feels. Does it make me, does it freak me out and make me feel scared and think about having to give myself injections for egg freezing and all of that? Does it make me feel excited? When I went back and had my appointment to think about essentially becoming a single parent by choice, a couple years after egg freezing, and was asking, what would I use those eggs? What would it look like? I left that appointment and just felt like I was sort of gliding on air, or gliding on, like I was floating for the rest of that week. And that affirmed for me that this is really something I wanted to do. The next week I woke up on a Friday morning and got really, and was worried that I couldn't actually afford a child. And that made me feel, and then I had sort of a couple, sorry guys. I sort of trusted my gut, my sort of sadness when I felt like that was a problem. And then I looked into finances and crunch numbers. And I'll echo what Dr. Klatzky said, that the people I found along this process, both friends of mine that I talked to as I was thinking about egg freezing and becoming a single parent by choice, the people who you don't know in your community, the people in your social group, at least this is true for me, who are, just your friends you've never talked to about this, I was surprised by how many people were thinking the same things or had frozen eggs or were sort of anywhere along this process, and people who've come to me and asked questions about all this. But there's a San Francisco Single Mom by Choice Facebook group that's been invaluable to me. And so I went to a meeting of this group that was just for people thinking about becoming a single mom or in the process of trying to get pregnant. And that meeting for me also sort of made it feel like it wasn't so hard, it wasn't so crazy. And I took a childbirth class with a few of those women. A few of them are on this call. And it's just, I think I really took it step by step and said to myself, can I do this? And every time it was sort of this giant leap of faith. And now I have a 12-week-old who you're all seeing and hearing. And I'll be totally honest, I have moments where I wake up in the morning and still wonder if I'm crazy and if I'm just, way over my head. And I'll let you know.
And Jill, one of the things that a lot of patients say is exactly what you said, am I crazy for doing this? And meeting other women who are like terrifically accomplished, just super confident, secure, amazing, who are doing this and parenting on their own, I think really helps a lot of people. So I think those communities, are really reshaping for a lot of women how they think about it and making them feel more comfortable thinking that way.
And Jill, too, I wanted to echo about just you being happy and how choice moms are kind of notorious for being happy and for their kids. Actually, the latest study done shows that that there's even more positive interactions between choice moms and their kids than between heterosexual couples that use donor sperm and their kids. So it's really like the research is showing that it's kind of a positive thing all around. So.
Question around the Jewish ethical quandary that Jill brought up a little bit about the destruction of genetic material, specifically embryos. And so what I would say is you can ask different rabbis and you'll get different opinions. There's the halachic decision that can be made, but the reality is that an embryo is not considered a life until it actually is implanted in a womb and is born out of that womb. And then it becomes a life. And so in Judaism, that's not something that we have to, kind of look that far afield in terms of being okay with destroying or donating embryos that could become a potential life for somebody else. There's also a question about the process of starting IVF and how much it costs to store frozen eggs. And people in California, of course, are now starting to think about the reality of, well, what happens if you have frozen tissue, like if you have frozen sperm, frozen eggs, or you have frozen embryos, and we go through power outages as happens so often in California. So is that an issue for people? And then also the cost. Can one of you speak to the cost of freezing human tissue and how much that costs today?
So costs for storage, whether it's an embryo or an egg, currently around the Bay Area, it fluctuates, but it's around $650 to $1,000 a year. At Spring, I think our current charge is $650 a year to store eggs. Creating eggs and creating embryos are about twice as expensive to create if you're including the genetic testing as they are of embryos. The medication costs are the same. They're about $4,000, $4,000 to $4,500. It depends on your ovarian reserve, your weight, and some other factors. But you could think $4,000 to $5,000 is a conservative estimate. And then the medication treatment, it also depends on a bit on the protocol. But freezing eggs, probably I can tell you at Spring Fertility, our cost about $8,700. The medication cost might be $4,000 to $4,500. So all in, one's probably looking at $12,000 to $13,000, and then an annual storage fee of about $650. Rolling blackouts, power outages. Any decent fertility center should have very excellent backup power. We have, a UPS as well as a generator connected, but that's for embryos that are in culture. Frozen tissue is actually not susceptible to a power outage. Eggs, sperm, embryos are frozen in liquid nitrogen. The liquid nitrogen does not require power, but power does notify alarms and sensors for when that liquid nitrogen level gets lower. But those are extremely secure and safe. For example, we keep ours in 20 to 24 inches of liquid nitrogen. When we're opening the tanks and using the liquid nitrogen from those tanks, we only lose about half an inch a day. And we refill them 3 times a week. If we left the top on, everything in that tank would be stable for over 40 days without refilling the liquid nitrogen. So power outages do not affect, it's not like your refrigerator or freezer, it's liquid nitrogen.
Great. And before we hand it over to Edith, there was a question specifically about as you kind of segmented, Peter, the different ages of women in egg retrieval. For older women who are on lower dose rounds, we're more likely to produce healthy eggs. Should patients who are over 40 advocate for themselves for low dose meds, getting fewer but healthier eggs, whether freezing eggs or embryos?
So there's a presumption that lower dose will get better quality eggs. The fertility world is divided historically into conventional fertility centers that do high dose FSH, and then what are called minimal stim centers that advocate for minimal stim. We do both. I probably do about 25 to 30% of my cases are minimal stim. Minimal stim is much less expensive. The cost of the medications may be $1,000 instead of $4,000 to $5,000. And really that's ideal. And often those are older patients. Those are often patients with only 2 or 3 follicles, maybe 1 to 4 follicles on their ovaries, and they're only going to get 1 to 4 eggs. The quality of those eggs is not better because of the lower dose. The patient who is 41, who has 15 follicles, will be better served with a conventional protocol than a minimal stim. But a patient who has 2 follicles or 3 follicles, blasting the ovaries with all these hormones. The hormones are called follicle stimulating hormone. They don't create new follicles. So we take a more nuanced, thoughtful approach. And so really the decision between minimal stim or mini IVF and conventional IVF should be around what is my ovarian reserve and what is a thoughtful, cost-effective approach to getting me to the end that I want to get to.
Great.
I hope that helps.
Thank you for that. That is exactly the information that they asked about. Before we end this, what I think is hopefully a jumping off point for a lot of people, and hopefully a lot of your questions have been answered. I want to say that it's been interesting in the last 6 months as a rabbi counseling people, and I was surprised that it's kind of been a half and half. Half the people that I've talked to are very eager in these 6 months to continue and try to have children, and half the people, actually younger people, millennials and above, are really having to have some first thoughts about the ethics of having children in our world today, given what's going on with the global pandemic, and looking around and seeing wildfires and seeing hurricanes and seeing what is the world like today. And so it's been interesting as a rabbi to counsel people who are things coming up right now for the first time and being a little more unsettled about those decisions because of the future being so unsettling right in front of us. And on the other hand, we've gone through things that are as difficult or more difficult than this as a Jewish people, and Jews have continued to have children. So what I would say is I encourage people to have children who want to have children. I encourage people to help raise other people's children. And if you do not become a parent yourself, there's so many other ways to encourage and lift up children, Jewish and not, in our world. And I think children are spectacular resources and gifts and treasures, and they all deserve to have a lot of loving adults around them. And so with that, I would say I hand it off to Edith and thank Hasidah and the kitchen and our community of Emmanuel for starting this conversation.
Thank you so much, Sydney, Rabbi Mintz, for your wonderful facilitation. And also want to emphasize what you said. The part of the reason we're doing it is because we do recognize that it's both a stress and a blessing. We are a family-based religion. We are pronatal. Judaism, absolutely in our most challenging of times when we were enslaved in Egypt, our ultimate resistance and our sign of hope was to have children. We just know in modern times, we're not living in those times, and it's really different. We have very different technologies. We have different set of life choices. For women in particular, we're living in unprecedented times, and the choice and the options are wonderful. They also raise a lot of challenges. I hope that this evening tonight helped us think about navigating through them a little more clearly. I hope that there may be some interest in some follow-up to this. Hasidat does have a Facebook group you can join. We also have meetups to connect with other people who are interested in questions about family building or experiencing going through treatments. We also have monthly programs and a Jewish content to address some of these issues. If you have something in particular you want to follow up with, please reach out to us. Also, if you're interested in following up with any of our speakers or having more information, I know that Samantha does have a practice, which she does. Rabbi Cozen Harel has written about this, and Spring Fertility also offers seminars and more information. So those are resources for you. And Hasidah also has many resources for you. I do want to thank each of our panelists individually. Samantha, Dr. Klatzky, Jill out there, thank you so much for sharing your time and bringing your expertise, and to Rabbi Mintz for facilitating this. And again, to the kitchen and Emmanuel for co-hosting this, and especially to everyone who came and participated. If you do have any questions, again, I have one more chat question coming in. A thank you from all. Please feel free to follow up with us. Thank you again to everyone, and have a good night.